Hi, Dr. Barrett in Miami, Florida. I wanted to briefly talk about a device that has really revolutionized rhinoplasty, at least in my opinion. I am not one to quickly adopt new technology or new devices or new instruments unless they have been proven to be extremely effective. And the Piezotome has been one of those devices. It has really fine-tuned the surgery, has made it less traumatic and expedited the recovery for my patients. But I think the most important feature of this instrument is the fact that it really allows me as a surgeon to have better control of the tissues of the nose and be a lot more precise as I want to be. Because as we all know, this is a surgery of millimeters, and I treat it as such as a rhinoplasty surgeon. So this tool has really enabled me to better serve my patients and give more predictable and reliable results. So this is the Piezotome, which I've been using now for several years, going on 3 years. It has been a tool that has been around much longer than that, particularly started in Europe and France. I had adopted it after several years that it was in the market, allowing it to prove its efficacy and its use for me as a rhinoplasty surgeon, and I love it. What I love about this tool is, as I mentioned, and you've probably seen me in surgery, is the fact that it allows me to be extremely precise. As you can see, it has multiple adaptations that we could use. The heads can be changed, allowing me to use it for different parts of the procedure. And the great aspect about this tool is that it's very specific to what it needs to address, and it also provides for water. It shoots out water, which allows for a cooling effect. And what this instrument does is that instead of using an old rasp or an osteotome, which I used to use in the past, it now allows for this fine instrumentation, which is a very light instrument. It's very easy to hold. I hold it like a pencil, allowing me to be extremely precise. And what this tip does is it vibrates at a very high frequency where you can't see, it's imperceptible to the human eye, and at the same time it shoots out water. And the water allows for a cooling, and it allows for minimal trauma to the surrounding tissues during the procedure.